We get a lot of questions about dental health. A lot of the people we come in contact with on the street actually either have not been to the dentist ever. Why do you think it's such a bad experience for some people?
You know, if you're in my parents' age group, there wasn't that compassion, I think, where dentists were trying to give patients this pain-free dentistry experience, whereas time progresses, that becomes more the focus. Some of it is also how you were raised. I tell my patients who bring in their children, please don't ever use the example of if you don't brush your teeth, you're going to end up going to Dr. Palavani's office and she's going to have to pull your teeth out. Those are all negative examples and connotations attached to the doctor. Our parents' generation did that to a lot of us. There's different options. You have to go to a dentist that's willing to offer them. Flossing is super key because most cavities occur in between teeth. So I like to make this example to patients. It's a little gross, but they get it. I'm like, if you were to chew a little bit of meat or some food that you had for lunch and you put that on the counter and you came back to it 3 days later, what would that smell like? What would it look like? So that's what's in between your teeth if you're not removing it. You can have genetic gum disease, which is periodontal disease, which is a certain bacteria in people's mouths that can be treated with different medications and different procedures, which is a little more rare than generalized gum disease like gingivitis, which is basically inflammation of the gum. It's just the buildup of inflammation and tartar and plaque, that the biofilm that sits on your teeth, that causes it. Dentists can always tell a patient has gingivitis if their gums are very inflamed and bleed a lot during dental cleaning.
I think the most expensive dental care comes from delaying treatment. So can you talk about the power of prevention and how that actually impacts the financing of your dental care?
Absolutely, Dr. Lisa, the power of prevention, that's the key word here. You know, a cavity will start in the enamel. You're not flossing, you're not doing your oral hygiene, it'll go into the next layer, dentin. If you don't take care of that and you start ignoring your dental appointments and you ignore the doctor telling you need to come in for a simple filling, within a year or two, that cavity grows, it's bacteria. It'll get into the nerve area. Then you need a root canal. Then you got to come back to the dentist and put a cap on it or a crown. So if you don't crown it, then you're looking at an extraction. Then when you get a tooth pulled out, you have two options. You get an implant, which the surgery and an implant crown is easily $5,000, $6,000. And then if you just leave the space empty, your teeth start drifting. People start getting TMJ issues. They start getting headaches. They start getting gaps in between their teeth, then malocclusion, where their teeth looks, malaligned and they need braces if they want to fix that cosmetically. You're looking at an array of other problems that you're adding to the list of having just done your filling or keeping up with your oral hygiene and your 6-month recall appointments at the dentist. Dental health starts with your overall health. So what you put into your mouth affects your overall health, and you need your teeth to chew food thoroughly so you can digest properly. What you consume also affects your dental health and your body. For example, too much candy is not good for your overall medical health, but also for your teeth. It's acidic, it could cause cavities. People underestimate teeth and how important they are, but a lot of my elderly geriatric patients have digestive issues and gastric issues because they don't have enough teeth to chew their food. So they're not getting the proper nutrition that they need. So teeth actually play a really huge role in your medical health. Thank you for having me, Dr. Lisa, and I will see you in 6 months.